Heart attack symptoms in men. A heart attack, also known as a myocardial infarction, is a critical and potentially life-threatening condition that occurs when there is a sudden blockage in the blood flow to a part of the heart. This blockage is often a result of a buildup of plaque within the coronary arteries, which supply oxygen-rich blood to the heart muscle. As a consequence of reduced blood flow, the affected part of the heart becomes deprived of oxygen, leading to tissue damage and, if not promptly addressed, long-term complications. Heart attacks are a serious and potentially life-threatening medical emergency that affects millions of men each year. In fact, according to the American Heart Association, heart disease is the leading cause of death in men in the United States. Despite its prevalence, many men are unaware of the warning signs and symptoms of a heart attack, which can delay treatment and increase the risk of complications. In this video, we will discuss the common symptoms of a heart attack in men, as well as important information on prevention and seeking immediate medical attention. By knowing the signs and acting quickly, you could potentially save your life or the life of a loved one. Recognizing the common symptoms of heart attacks in men. When it comes to heart attacks, time is of the essence. Recognizing the common symptoms can mean the difference between life and death. In men, heart attack symptoms can vary, but there are a few key signs to watch out for. One of the most common symptoms of a heart attack in men is chest pain or discomfort. This can feel like a squeezing or pressure in the chest, or even a dull ache that doesn't go away. It's important to note that this chest pain can also radiate to other parts of the body, such as the arm, jaw, back, or neck. So, if you're experiencing any of these symptoms, it's crucial to seek medical attention right away. Other symptoms to watch out for include nausea or vomiting, lightheadedness, cold sweats, and extreme fatigue. These symptoms may not always be present in every case of a heart attack, but if you experience any combination of them, it's important not to ignore them. Remember, recognizing the common symptoms of a heart attack in men is crucial for prompt medical attention and improved outcomes. If you or someone you know is experiencing any of these symptoms, don't hesitate to call emergency services right away. Acting quickly could potentially save a life. Why symptoms can differ from person to person. Heart attack symptoms can vary from person to person. First and foremost, our bodies are unique, and no two individuals are exactly alike. This means that the way our bodies react to certain stimuli, such as a blocked blood vessel in the heart, can differ greatly. Some individuals may experience severe chest pain, while others may have only mild discomfort or no chest pain at all. Another reason why symptoms can differ is due to the location of the blockage in the blood vessel. If the blockage occurs in a major artery, it can cause more severe symptoms and potentially result in a larger area of the heart being affected. On the other hand, if the blockage occurs in a smaller artery, the symptoms may be less pronounced or even go unnoticed. In addition, other factors such as age, overall health, and pre-existing medical conditions can influence the manifestation of heart attack symptoms. For example, older individuals may be more likely to experience atypical symptoms or have a higher pain threshold, making it harder to recognize the signs of a heart attack. Recognizing the symptoms of a heart attack is crucial, especially in men, as they may experience certain distinct indicators that signal a potential cardiac event. While symptoms can vary from person to person, there are several common signs that men need to be aware of. Prompt identification and appropriate action can significantly improve the chances of a positive outcome and prevent further damage to the heart. Silent heart attack. This type of heart attack is characterized by a lack of noticeable symptoms or only mild, vague symptoms that may be mistaken for indigestion or muscle pain. Silent heart attacks often go unnoticed and are diagnosed after routine medical checkups or tests. They can still cause damage to the heart muscle, and individuals who have had a silent heart attack are at an increased risk of having another heart attack or developing heart failure in the future. It's crucial for individuals at risk to undergo regular checkups and be mindful of potential warning signs even in the absence of overt symptoms. Symptom recognition. Men often tend to recognize the more typical symptoms associated with a heart attack, leading them to seek medical help promptly. On the other hand, women may experience more subtle symptoms such as shortness of breath, unusual fatigue, or nausea, which can be easily mistaken for less serious health issues. This disparity in symptom recognition contributes to the underestimation of the risk of heart disease in women, leading to delayed intervention and poorer outcomes. Underlying risk factors. While both men and women share common risk factors for heart disease, such as high blood pressure, high cholesterol, and smoking, women may be more likely to develop heart disease later in life compared to men. Additionally, certain risk factors, such as hormonal changes during menopause, pregnancy complications, and autoimmune diseases, can significantly impact women's cardiovascular health. Understanding these unique risk factors is crucial in implementing effective prevention strategies tailored to women's specific needs. If you enjoyed this video, please give it a thumbs up and subscribe for more. Signs of a heart attack: chest pain or discomfort. This is one of the most prevalent symptoms of a heart attack. Men often describe it as a feeling of pressure, tightness, fullness, or pain in the center of the chest that may last for a few minutes or come and go intermittently. The sensation might be mistaken for indigestion or heartburn, but it's typically more severe and persistent. Pain in other upper body parts. Apart from the chest, men may experience discomfort or pain in other areas of the upper body, such as the arms, back, neck, jaw, or stomach. This pain can manifest as a dull ache or a sharp, shooting sensation, and it's often accompanied by chest discomfort. Immediate actions to take when symptoms occur. When it comes to heart attacks, time is of the essence. Recognizing the common symptoms is crucial, but taking immediate action when symptoms occur can be the difference between life and death. If you or someone you know experiences any symptoms of a heart attack, it is vital to act quickly and seek medical attention. Shortness of breath. Feeling breathless or experiencing difficulty in catching one's breath, especially during minimal physical exertion or at rest, can be indicative of a heart attack. Men may feel like they can't take deep breaths or might struggle to perform simple tasks without feeling excessively winded. Sweating. Sudden, unexplained sweating, particularly when it's not attributable to exertion or external temperature, can be a warning sign of a heart attack. The sweating might be profuse and is often accompanied by a sense of anxiety or impending doom. Nausea and vomiting. Men experiencing a heart attack may also feel nauseous or might vomit without any apparent cause. This symptom is often reported alongside other warning signs and should not be ignored, especially when occurring in conjunction with chest pain or discomfort. Lightheadedness or dizziness. A feeling of lightheadedness, dizziness, or a sensation of fainting might be an indicator of a compromised blood flow to the heart. Men might feel unsteady on their feet or might even lose consciousness, particularly when combined with other symptoms. Fatigue. Unexplained and extreme fatigue, even after sufficient rest, can be a sign of an impending heart attack. Men might feel an overwhelming sense of tiredness or weakness, which might be persistent and not alleviated by the usual means of relaxation or sleep. It is important to note that not all individuals experience the same set of symptoms during a heart attack. Some men might not even exhibit classic signs such as chest pain, making it challenging to identify the condition solely based on common indicators. Moreover, certain individuals, particularly those with diabetes, might have atypical symptoms that are not as easily recognizable. In some cases, heart attacks can occur silently, without causing any noticeable symptoms. These silent heart attacks are especially dangerous as they can go unnoticed and lead to significant heart damage over time. Regular medical checkups, especially for individuals with risk factors such as hypertension, high cholesterol, obesity, or a family history of heart disease, are essential for early detection and prevention of complications. Before you leave, don't forget to like and subscribe to our channel for future interesting videos like this.